Shut up and sit down.
Alzheimer's disease essay. Essay on Alzheimer's disease for students and children in English. A German neurologist named Aloysius Alzheimer discovered Alzheimer's disease in 1906 after studying the case of a middle-aged woman named Auguste D. After her death, he found senile plaques and neurofibrillary tangles as he did an autopsy. Alzheimer's disease, or AD, is a form of dementia that leads to the loss of a person's ability to think and reason. It destroys the memory as neurons are injured and die throughout the brain, resulting in a breakdown in the connections between networks of neurons. Major brain regions begin to shrink. By the final stages of Alzheimer's significant loss of brain volume is seen, which is called brain atrophy. The most crucial symptom of Alzheimer's is memory loss, and the person faces difficulties in remembering. It also leads to occasional memory lapses. An Alzheimer's patient often gets lost in familiar places and also does not find the right word to identify objects and often tends to forget close relatives and family members. Alzheimer's reduces the ability of thinking and reason considerably, and the person fails to make decisions or proper judgments. As the disease progresses, the patient often forgets to perform familiar tasks or even basic tasks like bathing or dressing. An Alzheimer's patient undergoes many behavioral and personality changes like depression, delusion, and mood swings are prevalent. Distrust, social withdrawal, changes in sleeping patterns, and aggressiveness also occur. Alzheimer's is caused by a combination of genetics, lifestyle, and environmental factors over time, though the exact reason causing Alzheimer's is yet to be found. The problems with brain proteins disrupt the proper functioning of the brain cells and eventually die out, resulting in a loss of significant portions of the brain. The human brain is characterized by amyloid plaques and neurofibrillary tangles caused by significant brain degeneration due to Alzheimer's. A leftover fragment of a larger protein called beta amyloid and its clustering have a toxic effect on neurons and it disrupts cell-to-cell communication. Neurofibrillary tangles are abnormal accumulations of a protein called tau that collects inside neurons. Apart from these, chronic inflammations, vascular problems, and cell death are major characteristics of Alzheimer's. The early symptoms include mild forgetfulness, anxiety, confusion about time and place, communication difficulties, and loss of spontaneity and initiative. Toward the progress of this disease, short-term memory loss and confusion increase with a shorter span of attention and severe forgetfulness and even recognizing family members. In the last stage, the inability to understand incontinency and failure to recognize self or family is common. Researchers show that 60 to 90% of Alzheimer's cases exhibit various cerebrovascular pathology. Strokes are prevalent in patients with Alzheimer's syndrome and worsen the cognitive decline substantially with various internal and external disorders. The risk factors include increasing age, genetics, and Down syndrome specifically. Obesity, high blood pressure and cholesterol, history of a previous head injury, blood vessel disease, etc. are also considered. A thorough diagnosis of an Alzheimer's patient is made by assessing a person's medical and psychiatric history and brain scans. CT, MRI, and PET scans are done to determine the level of mental deterioration. Apart from these, blood and urine tests are also done along with proper neurological and physical examinations. 10 lines on Alzheimer's disease in English. Alzheimer's disease gradually leads to loss of memory. A person diagnosed with AD experiences an inability of thinking, recognizing, and making judgments. AD damages the brain cells and tissues, resulting in the loss of an essential portion of the brain. Brain damage is associated with the buildup of abnormal proteins that form plaques and tangles around the brain cells. Family members face difficulties as a person's condition deteriorates and are unable to recognize loved ones. Medications help to control sleeplessness, agitation, aggression, and depression. There is no prevention of AD, but reports suggest a healthy lifestyle might reduce the risk. Regular physical activities have a protective effect on brain health and reduce the progression of AD. In AD, the loss of neurons spreads predictably and brain size shrinks significantly. Risk factors include genetics, Down syndrome, post-head trauma, heart and vascular diseases, etc.